So welcome again, ladies and gentlemen, to this webinar. And my name is Foike Tolani, and I work with Bedford Borough, Milton Keynes, and Central Bedfordshire councils. And tonight I have with me people, specialists, GPs from the clinical commissioning group in Bedford, Milton Keynes, and also Central Bedfordshire. We also have our host tonight, and that is the Miracle Church of God in Christ. We have with us Pastor Francis Vaughan, and he's going to introduce the panelists. So I'm going to call on Pastor Francis to introduce the panelists, and after that, I will be moderating tonight's session, and I will welcome questions from people for this event. So I would ask, if you have questions, please kindly use the chat box. Put your question in the chat box and we'll try to answer your questions. In the course of this evening, we would also try to look at different issues or common questions that have been asked in the past few weeks and months since the COVID vaccine are being administered in the United Kingdom. So once again, welcome everyone. And I'm going to call on Pastor Francis Vaughan to open this webinar. Thank you.
Well, welcome one and all. For some of us here is good evening, others good day, other part of the world is good morning. But for one and all, it's a joy to welcome you with this great panel of 5 doctors tonight, 4 of which you can see, 1 you cannot see, and you will ask who the next one is. Next one is Dr. Luke. He traveled with Jesus and also with the Apostle Paul. He is the writer of the 2/3 of the New Testament. And what I am saying tonight is really humbling. I find it extremely difficult to express in words adequately my profoundest gratitude I owe to these doctors who have taken the time off to show love. Myself, I'm a Christian minister here. I serve here in Bedford, but not just in the church. I worked as an assistant chaplain for over 35 years in Bedford prison, well, in the prisons in England, really, and the hospitals and the homes. So I am no stranger to people who have difficult situations, but this time it is a time of great need when each one, especially those in the front line, have really earned our love and appreciation. And we cannot express it in words tonight how much we owe to them. These doctors who have taken the time off tonight, they are there to help us, just to say that God uses things in the Bible, and he uses a handful of salt, really, to change a river water. He uses the serpent when they were bitten in the wilderness to heal the nations. And Jesus Christ himself, he spat and made clay and put it on the blind man's eyes, and he received his sight. And many great miracles have happened through people. When you ask God for a miracle, he gives you a plan. And tonight, I must say that we welcome you, doctors, and we are grateful for your good works. And I would like you tonight, really, because of time, I will come in when you want me to, but please, please, just introduce yourself for me. God bless you. Can you give me the first one, doctor?
Okay, thank you very much. So my name is Foike Tolani. As I've explained, I'm the moderator for this evening's webinar. And I'm Senior Public Health Officer, Health Protection and Disadvantaged Groups, working across 3 county councils, Bedford Borough, Central Bedfordshire, and Milton Keynes Council. So I will be moderating tonight. Thank you. I'm proud to join in the council last year, I've been working for Oxfam as a public health advisor, and I've been opportunity to work in more than 20 countries, responding to different types of crises and emergencies. So I do have behind me a wealth of experience in responding to crises. Thank you. I'll hand over to Dr. Batty.
Thank you, Foy. Thank you, Pastor Francis Wogan. I'm Dr. Bharti Kumaravel. I am the consultant public health. I work across Bedford, Milton Keynes, and Central West, just like Foy. I'm leading on health protection, and I'm also a senior clinical lecturer at the University of Buckingham Medical School. I lead on public health and evidence-based medicine. So together with Foy and the CCG, we have been tackling inequalities in vaccine uptake. So very pleased to be here.
Thank you. Now, the next one, please.
Hi, I am Dr. Linus Unna. I'm a local GP at the Ivell Medical Center in Biggleswade, Central Bedfordshire. I have been living and working in Bedfordshire for about 4 years now. I also work for the local clinical commissioning group, which is the organization that organizes and buys health services across Bedfordshire, Luton and Milton Keynes. And it's a real pleasure to be with you this evening. I'm looking forward to having some really good conversation and hearing from everyone on the call to understand your views on the vaccination and hopefully discuss any concerns and reservations that people might have. I think it's important that people feel free to express themselves and to understand that this is a safe space for us to have a genuine discussion about the vaccine and the challenge facing our community. Thank you very much.
Thank you, Doctor.
Good evening, everyone. My name is Dr. Daya Kuku. I'm a GP in Bedfordshire. I work at plastic surgery. I'm also a clinical lead within the Bedfordshire Clinical Commissioning Group. I'd like to say welcome to everyone who's taking time out of their busy evening after a busy day. We are here to answer your questions. And I'd like to say it is okay to have questions. What is important is that you get your answers from the right source. We are here to sort of deal with misinformation, misconceptions, misperceptions, and distrust. So there's a lot of information out there, but a lot of them are not accurate. The information we'll be sharing today is based on available scientific evidence. And I like to say myself and my colleagues will be sharing with you what we know as of today. So COVID-19 is an illness which is under review and evidence is evolving. So as evidence evolves, we share it. And so I'm going to encourage everyone to feel free to ask their questions because this should be an interactive session. Thank you for having us.
Thank you very much. And may God bless you and the team. And just to let you know on my part that I have had both vaccinations. And I can encourage, this is why we're hosting this meeting. If we can help somebody, please, no inhibition, no fear. Put in your points. There are biblical points that some of you are really asking about. Is this the mark, the time, what it's all about? If I'm here tonight, if I can help to answer some of your questions. So please feel free. So long as we can help you tonight, then we would have done our job. God bless you, doctors. Thank you very much. All the best.
Oh, thank you so much, Pastor Francis Van, and thank you to all the panelists for the introductions. So just before we start to answer some of the questions we have received and the ones that we're still going to get tonight, I'm just going to quickly run us through the background, just a bit on the COVID itself, on COVID-19. So as we all know, COVID-19 is a contagious disease, and it started December of 2019, and now it is now a global pandemic. And because this webinar is being hosted by Bedford Borough County Council, as well as the Miracle Church, we felt we should give some quick updates on the situation in Bedford Borough. In Bedford Borough, the situation right now is the number of cases are going down, which is good news. But we can also attribute this number of cases that is going down to the lockdown and also the vaccine that people have taken in this particular county. But the good news is not just in Bedford Borough, it's all over the country that we have the number of cases going down by the day, in addition to the number of deaths in these counties as well. So if you look at the data that is on the screen, you can see that across the different age groups, the number of cases are going down in Bedford Borough County Council. In terms of national updates, in the United Kingdom, we have a scenario where over 4 million people have had the COVID infection, and also over 120,000 people have sadly lost their lives. And that is why tonight's meeting is very important, which is about how do we ensure that this type of scenario, or we don't lose lives anymore. And also over 30 million people have received their first dose, which is good news. And we hope that by having this session of answering questions that people may still have, it will encourage more people to make up their minds to take the vaccine so that it can contribute significantly to reduction of COVID infections and death in the country and also in our county councils. In one of the things that is worth mentioning that by the 7th of April, nationally, the Public Health England estimated that at least 6,000 deaths in the first 3 months of 2021 have been prevented due to COVID vaccine. So yet again, we can see the advantages of the vaccines and the fact that people are taking the vaccines. And analysis of infection data since the introduction of the COVID-19 vaccines in the United Kingdom demonstrates that vaccination is highly effective and substantially reduces the risk of infection and severe COVID-19 disease. So in the United Kingdom, and I know this is different in other countries, the focus now is vaccinating people 50 years and above, and also people with clinically extremely vulnerable individuals, as well as health and social workers, and also people who are at risk. So this is the priority for now. And the reason why this first 9 cohort groups are being prioritized is because, for instance, if you look at the age, people 80 and above, you find that if you are able to vaccinate 20 people, you'll be preventing 1 death, which is quite significant compared to if you focus on people who are under 50s, which is important, but you need to vaccinate about 47,000 people to be able to prevent 1 death. And of course, they are very important, but not just vaccination alone. We're still encouraging people to practice physical distancing, wear a mask, hand hygiene, cough etiquette, avoid touching of the face, be conscious of being in crowded areas. Ventilation is equally important. And then if you test positive or you're in contact with somebody who might be positive, it is important to also isolate or quarantine. And of course, vaccine is equally important. So today, as we said, it's about questions and concerns. Express yourself. Please use the chat box. And we know we may not be able to answer all the questions, but please and please, after this session, if you have unanswered questions, we're going to put all this information in the chat box. You can visit the CCG website. You can visit Bedford Borough, Central Bedfordshire, Milton Keynes Council website. You can also visit one of the panelists' Instagram page at Healing Zone. And if you still have questions, you can write us at publichealth@bedford.gov.uk, or you write to the CCG inquiry email address. All this information will be in the chat box. So I'm going to stop there. It's just to kind of give a quick background of why we're having this meeting, why it is important for us to understand the effects of the vaccines, and also to know that, we've had so many questions about, is it safe, is it not safe? Well, we know it is safe and it is effective, And of course, we can see the impact already estimated of 6,000 lives have been saved just within the first 3 months of this year. So without further ado, I'm going to now call on each of the panelists. I'm still looking at expecting questions. So we have some questions. Before we go into the questions, I'm going to call each of the panelists to just quickly share with us in 2-3 minutes some of the frequently asked questions, because you know they're all health practitioners. They do get questions all the time. So I'm going to ask them to just tell us in 2-3 minutes some common questions and also answers to those questions. And then we'll take the questions that we have in the chat box. So the first person I'm going to call is Dr. Dayo Kuku. Dr. Dayo Kuku, in 3 minutes, can you just tell us some of the frequently asked questions? Thank you.
Sorry, I didn't hear the question.
So I said, can you just run through some of the questions people have been asking you as a medical doctor?
Okay, thank you. Yes, so some of the common questions that we have come across, one of them is people are worried that the vaccine has come out in a very short period of time. So people are not confident about it. And what we say to that is the fact that the vaccine has gone through the necessary rigorous check system. So normally vaccines will take 2 to 3 years before they come out. But this time around, because of the COVID-19 disease and the impact on life and the global effect, 3 things have happened. There has been a lot of funding pumped into it, and this funding has actually helped produce the vaccine quicker, sooner than later. The other thing that has happened is there has been a lot of collaboration globally. So people have come together to look at solutions, to find solutions within a short period of time. Also, there has been a lot of volunteers. So in the past, you have to sort of put a lot of things out there to ask people to volunteer. But because a lot of people have been impacted by this COVID-19 disease negatively, people have actually come up as volunteers to say, we want to get involved in these trials, and that has made it easier. The other thing that has happened is also the fact that all over the world, there has been the use of the emergency. So normally when vaccines are made, they have to go through one step after the other. But what has happened this time around is the process has run concurrently. So instead of waiting for step 1, step 2, step 3, they have run side by side. So I just want to reassure people that concerning the vaccines, there has been no cutting of corners. The safety measures, the monitoring measures, the efficacy data, all of it has gone through the normal process. That I hope that would encourage people who are worried that it has come out in a short period of time. The other bit which I'd just like to talk on before my other colleagues jump in will be people are worried about, if I'm pregnant, can I have the vaccine? It has been found to be safe in pregnant people. The only reason why it's not routinely offered to pregnant women is because pregnant women were not involved in the trials. Having said that, a few people who did not know they were pregnant got the vaccine, and it has been found that they did not have any adverse effects. So the current guidance is that if you are pregnant, the recommendation is that you discuss it with your healthcare provider or your GP. And the ones that, especially if you're a frontline worker, if you're in social care, if you're at increased risk of exposure to COVID-19 disease or patients, then you should be considering taking the vaccine. And if you're worried, then you need to actually discuss that with your GP. A few people have asked, is it going to affect my fertility? No, it is not going to affect fertility. Nothing in the vaccine will affect your fertility. And the guidance is you don't have to check whether you're pregnant before you take the vaccine. It is safe enough. And the Royal College of Obstetricians have actually put a statement out there to say they endorse the fact that pregnant women can take the vaccine. What we need to remember is that the vaccine actually prevents us from the risk of complications. So COVID-19 is a multi-system disease. It affects almost every part of the body. And if you get that disease, and you get the complications from it, that could be very, very life-threatening. So we have the long COVID, which is a condition which people who have had COVID-19 disease will have. So most people will get better within the first 4 weeks, but a few people between 4 weeks, from 4 weeks onwards, get persistent symptoms. The vaccine will prevent you from getting complications and also will prevent hospital admission and the risk of death.
Oh, thank you very much, Dr. Dyer. And indeed, I think that's all the questions you've addressed have been concerns we've had even from our interactions with working in some of the care homes. So I hope that that has also answered some questions people may have tonight. Thank you very much. I'm going to call on Dr. Bharti Kumaravel to also give us some of the questions that we've been receiving from public health. Thank you.
Thank you, Foye. Thank you, Dayo. That was a really good introduction. From public health perspective, we would like to assure that vaccines are safe, they're effective. I would like to reiterate what Dr. Kuku said. They've been rigorously tested. There's no hesitance from ours and any of the senior officials that we are not worried about the safety or efficacy. How come it came up very quickly? In addition to vaccines, please let's not forget to make sure we are wearing masks, we are having social distancing, and we are washing our hands regularly. And now, as we are allowed to mix more freely with others, let's not forget to ventilate. Let's not meet indoors as far as possible. If you're meeting indoors, please wear your masks and keep the distance and keep windows open. Ventilation is really important. As far as possible, let's meet outside. And as Dr. Kuku had said, there's no hesitancy about fertility. Experts have looked at it. There's no evidence that it affects. And I would like to please restate that if you're looking for information, often people look to what their neighbors say, their peers say, what is found in social media. If there's any information, there's so much misinformation out there. It's really important to see where's the information coming from. Is it a trusted source? Is it your GP? Or is it a health authority? Like here, it's the gov.uk, or is it CDC, is it WHO? Who is providing that information? You need to really check for the source of information before taking it on board. So that's really important. And I would encourage, I've had my vaccine. My husband has had his vaccine. My parents back in India have had their vaccine. Vaccines are safe and they are effective. It's because of effective vaccines that we have eradicated smallpox. It's really important to remember that. And we are near eradication for polio as well. So they are really safe and effective. Please, if you're offered the vaccines, if you have any questions about the vaccines, go and speak to your doctor rather than someone else, someone who's got the authority in that field. And then once your queries are answered, please try to have the vaccines. There are 2 vaccines available and both of them are safe and equally effective. Thank you.
Thank you so much, Dr. Bharti Kumaravel. And I think that's really important, this whole aspect of when you get a video on your WhatsApp or when you get a message, it is very important to check the source. I advertised this event with friends, and one of my friends sent me a WhatsApp message from a professor of medicine, where the professor actually said that if you get the vaccine, you're going to die in 5 to 10 years time. And so the name of the professor was there. And what I just did was to Google the name and search. And I realized that the professor is actually advocating not just that you shouldn't take the vaccine, but you shouldn't wear masks and you should not observe social distancing, which I think we all know all these things, they do work when you wear your mask, when you observe social distancing. And in addition to that, the professor is a naturalist. So some people are actually using this to make money for themselves. So it's always important to check the source of the information. And if it is not true, don't share it with someone else. So that's very important as well. Thank you so much for that. We now have some questions in the chat box. And but before we take the questions, I'm going to give Dr. Linus Ona 2 to 3 minutes also, because he's been in so many webinars, so he's very familiar with the frequently asked questions. Dr. Linus Ona, please.
Thank you very much, Dr. Talani. One of the questions that we often get asked is about the content of the vaccines. So what's actually inside these vaccines that we are talking about? And there's concerns from people on a range of things, whether it contains animal products, it does not, whether it contains products from aborted babies, that's incorrect, it does not, whether it contains substances or materials that are against any religions, so the sort of the more popular religions, and it does not. And what I would like to do, if technology allows, is to share the contents. So what's actually inside these vaccines, to just share that briefly so that people you can take a screenshot of the contents of the vaccine, and you can ask questions around that if you want. People also worry that it contains microchips. As you will find shortly, that's not correct. It does not contain microchips. So I'm just going to try and put on share my screen. And I hope that you'll be able to see the contents of the Oxford AstraZeneca vaccine now on the screen. So it's basically what it contains, the Oxford AstraZeneca, is a virus that causes common cold, but it's from chimpanzee, but it has been inactivated. So they've treated this virus in the lab such that the virus is not able to replicate, it is not able to make more of itself. The body cannot make more of it. So it's harmless virus that they've then put a blueprint from the COVID-19 virus inside this inactivated cold virus. So the blueprint is something called, it's a chemical signal that determines what kind of protein or substance that the COVID-19 produces and uses to enter into the human body. So what this blueprint does is that it makes the body produce similar proteins to what is on the COVID and trains the body's immune system so that by the time or if the body encounters the actual infection, it will have recognized that infection from that earlier encounter with the vaccine. So it's almost like preparing for, having the chance to prepare for a fight before the day of the fight. That's what the vaccines do. They enable our body to prepare for the fight before the actual COVID virus comes around. And so if you look at the contents, it's basically, substances that are very commonly found in other medical medications that we use, including the ones we buy over the counter. So if you look at, it says sucrose here. Sucrose is basically the common sugar that we use in our drinks and things like that. That's what sucrose is. Sodium chloride is the table salt that we use. Water for injection is just water. L-histidine is just amino acid, basically. Magnesium chloride is just a salt. It's not a common salt, it's a different kind of salt. And polysorbate is quite common in other medications. It says here ethanol. Ethanol is the chemical name for alcohol, but actually these are in very tiny amounts. And they are so tiny that actually you find more alcohol in fizzy pop. So if you buy a can of Coca-Cola from the shops, there will be more alcohol in there than you'll find in the vaccine. So the point is that there's nothing here that is from an animal product. There's nothing here from aborted babies. There are no microchips here, as you can see. Now we're going to move on to the, just very quickly to the Pfizer vaccine. And again, you can see that this is a list of the substances in the Pfizer vaccine. And there's nothing here from aborted babies or from animal products, or indeed there's nothing from there's no microchips on the list of items, and it's still very common substances that it's found in the house, in over-the-counter medications and things like that. The first three items are basically different forms of fat. Cholesterol is a form of fat, as many of us will be aware. Sodium chloride, again, sucrose, water for injections. The important thing to highlight here is that none of the sort of the common stories that we hear about the content is right, because these are the contents of the actual vaccines. You can take a screenshot of them. And thank you very much. I'm going to stop sharing.
Yes, please. Thank you. So thank you very much for that. And this is very important because people have asked, oh, it contains alcohol and my faith does not allow me to take alcohol. The alcohol that is in it is very, very little and almost insignificant. So, and many of the faith groups have already come out to say that the alcohol in this is insignificant. It's what you find in a lot of food that you take. So it doesn't affect your faith or your belief, and it's not going to intoxicate you. And so that's very important. And also it has nothing to do with 5G. I still met someone today in Milton Keynes and she said, well, I'm not going to take it. It's related to 5G. I said, what's 5G? Or it has some chips in it. It doesn't have chips in it. Or it's related to Bill Gates. For goodness sake, it's not. So please and please, this is the content, and let us be convinced that nothing else that will harm you or trace you has been added to the vaccine. So I'm going to start with the questions on the chat box now. Thank you again, Dr. Ona, for the explanation you've just given. So to the very first question that we have here, and I'm going to allocate the questions to the panelists, and we'll they take the questions in turn. So the first question, have there been incidents of blood clots in the patch of AstraZeneca jabs? So I'm going to give that to Dr. Kuku, but because of time, I'll give the second question to Dr. Kumaravel. Is the vaccine the only way to keep the immune system primed? And the next question I'll give to Dr. Ona. Is it safe for those who suffer from a lot of allergies, such as and some foods, to take the vaccine? So the first question again is, and this is to Dr. Kuku, have there been incidents of blood clots in this patch of AstraZeneca jabs?
Yeah, thank you very much. That's quite a topical and very important question. So recently, as of the 31st of March, it was reported 79 reports of clots. So it's called thromboembolic events, which is cases of clots. It's called cerebral venous sinus thrombosis. And these are episodes where people have clots in their brain. And it's also associated with low platelet counts. The evidence at the moment is under review. And so we will know that the Oxford AstraZeneca vaccine has actually been halted for young adults and people under 40, just because there's ongoing investigation into it. The guidance at the moment is that if you have risk factors for clots, and this will include things like if you already have a previous episode, if you have a risk of DVTs, a known increased risk of DVTs, there's something called antiphospholipid syndrome. So you will know, if you need to discuss this with your physician, your healthcare provider, your GP, as to your risk of clots. If you have that high risk of clots, then it is recommended that you do not take the vaccine. Otherwise, it is safe generally for most people to have the vaccine. The recommendation at the moment is if you have a headache, last from day 4 onwards. So in the first 4 days of having the vaccine, it is possible that you will have a headache. And I'll use myself as an example. I had the Oxford AstraZeneca vaccine. I've had my 2 doses, but after my first dose, I had a splitting headache. was a very serious headache. It was almost like a migraine. And I was very tired and I had to go to bed. But I got over it within 24 hours. So with the history of clots, the recommendation is from day 5 to day 28. If you have a severe headache, and this headache is not just a simple headache that will go away with paracetamol or ibuprofen. This is the headache where it's outstanding. When you're coughing, it may get worse. Whatever you do that increases strain may make it get worse. If you have that kind of headache, then you should immediately seek medical advice. If you talk to your GP, it's likely that they'll either send you to the hospital where you'll have a blood test done. The blood test will then either reassure you or get you referred to the specialist if you are suspected to have a clot. So I think concerning blood clots, I need to say, discuss your concerns with your healthcare professional. It is still safe to get the vaccines. And we need to put it in context. So in the UK, over 30 million have been vaccinated. 79 people out of 30 million have had the clots. We cannot relate it directly to the vaccine. So there's something called cost and there's something called correlation. So cost simply means it's directly related to the vaccine. Correlation means it might just be a coincidence. And we do know that COVID-19 disease itself causes clots. So at this point in time, we're not sure if it is the fact that these people would have had it due to COVID-19 disease or whether they had a predisposing factor in the background that would have caused the clots. And even if it was 79 out of 30 million is not a reason why everyone will stop taking the vaccine. I think what we need to do is to be aware. If you have symptoms after you've had your vaccination, then you need to discuss it with your healthcare professional. And I don't know if I can just stop and actually just go through the symptoms that you may have after you've had your vaccine. So after your vaccine, even if you take paracetamol, some people get side effects from paracetamol. People get side effects from medication generally. So when you have the vaccine, you may have side effects. But the important thing is these side effects are temporary and reversible. So they usually would last 24 to 48 hours. In the worst case, it could last up to 7 days. Any side effect lasting more than 7 days after your vaccination has to be attended to. You need to seek medical attention. And these common side effects are things like pain at the site of injection. Some people will complain of headache. Headache 4 days after the vaccination is still acceptable. Use paracetamol, have a lot of rest, drink a lot of water. And if you can have ibuprofen, you can have that. Other people have aches and pains. Some people have lethargy, tiredness. I had that, but it just took 24 hours. And some people will have enlarged glands. That's a minority of people. But all the side effects are very short lasting and reversible. So I hope that has answered your question.
Thank you very much, Dr. Koko. Thank you. And also, in addition to that, it's possible that you don't even have any side effect. I did not have side effects. I just had like somebody pinched me on my arm. And it doesn't also mean that if you don't have side effects, some people have asked, does it mean that I'm not, I don't have immunity? It doesn't mean that. It's just we're all different. So thank you very much, Dr. Dyer. I'm going to go to the second question, which is the vaccine the only way to keep the immune system primed? Dr. Kumarabe, please.
So vaccines, how they work is they help in teaching the body to recognize an important pathogen, and they've got a small genetic material which goes inside the body, and it prepares your body to provide some immune response so that it primes your body, it primes your immune system, so that in future, if you get the real infection, if you're encountering the real infection, it can protect you. So that's one way of priming your immune system. But in general, healthy nutrition is also important. And if you're taking your multivitamins, keep taking them. Vitamin D is supposed to help, and zinc and vitamin C. So the usual multivitamins with a healthy nutrition along with vaccines will help in priming your immune system. I would like to stop there. Dio and Linus, if you would like to add to that.
Thank you. I think that's comprehensive. The only thing to say, because very often when people ask questions around this, sometimes they are wondering, I mean, if I'm doing all these things that you explained, why do I need a vaccine? you know, and the fact is that for the common infections that are around in the environment, that we've already, you know, the body is already used to those common infections. Just being healthy, eating healthy, exercise, maintaining a healthy weight, you know, will be sufficient. But for this new virus, which we have never encountered before, it's a new infection to the human body. Those things may not be sufficient in themselves. So this is why the body needs extra help, because we are fighting with a new enemy that has never been exposed to our body before. And like Dr. Kumarawa has just explained, basically the vaccine gives our body that forewarning, which we don't have. So that's why we need a vaccine, even if we're doing all those other things. I hope that helps.
I'd just like to just add on to that, that when we get these vaccines, most of the time it could take your body up to 2 weeks to build up a full immune response. So it's very important that even after you have your first dose, you still do the guidance, which is hands, face, and space. You must remember to continue to wash your hands, put on your face mask, and also maintain at least 2 meters when necessary. The other bit to it is, it's very important, just like Dr. Bahati said, that you actually have your 2 doses, because the first dose is almost like a primer. The second dose is then what prolongs the immunity. So the first dose will sort of prime your body and get it ready to fight. But if you don't take the second dose, then you don't get that long-lasting immunity. We don't know how long it's going to last for now, but the second dose is very important. So usually they say the first dose could give you 90%. The second dose will give you 95 based on which vaccine you get. I think the Oxford, they say might be 70 and then 95. So I want to emphasize the fact that it is important that we take the 2 doses. Thank you.
Thank you. Can I just add, Dr. Chalani, one more thing. Some people ask, if I've had the COVID infection, do I need the vaccines? Because I'm already immune. We need to know that if you have the infection, there will be some immunity, the natural immunity, but we don't know how long it lasts. We think it will be just 3 months to 6 months, whereas with vaccines, we'll have longer term immunity. So even if you've had the COVID infection, please go and have the vaccination. We are usually asked to wait for, if you've just recently had an infection, wait for 28 days, but then go and have your vaccination. Just wanted to remind people that as well. Thank you.
Thank you, Dr. Bahati. To back that up, there was an evidence released by Public Health England in the Siren report. And what it said was that for people who have had the COVID-19 disease, 83% had their immunity lasting for up to 5 months. So with the infection, your immunity could last up to 6 months. But then what happens after 6 months? The vaccine, when you take it, will protect you for longer. So just to back up what Dr. Bahati said. So even if you've had COVID-19, if you've had long COVID, the recommendation is that you still go ahead and have your 2 doses of the vaccine.
Yeah, thank you so much. I was actually going to also mention that I met someone today who had COVID, and he came to me and he said, I had COVID some months ago. Do I still need to have the vaccine? And I said, yes. And he said, by the way, have you met anyone today who is refusing to take the vaccine? And I said, yes. He said, maybe they need to come and talk to me. So it's kind of saying that this is real. It's no joke. So please and please, it will really help to give you immunity, protect you, protect your family, protect your neighbors, protect your community. Thank you very much. So we go to the question on, is it safe for those who suffer from a lot of allergies, such as and some food? And there's also another similar question, which is, what about people with allergies when it is not known what you are allergic to? Dr. Ona, please.
Thank you very much. So this is a really important question because of obviously in the UK, at the early days of the vaccination, there were 2 reports of immediate reactions to the vaccine. So if you have allergy to food, it's unlikely that you will react to the vaccine because the contents they're not the common things that cause allergic reaction from food. If you have if you have hay fever, for instance, that's not a reason not to take the vaccine. Because there is no pollen in the vaccine, so you wouldn't react to the vaccine because you have hay fever. If you have allergy to the vaccine itself. So if you've had one shot and you had a reaction to the vaccine that was allergic in nature, and the allergy to the vaccine is immediate. It's not something that happens a day or two later. It happens right away. That's where we know that it's the vaccine causing the allergy. So if you have had a reaction to an initial dose of either of the vaccine, but particularly of the Pfizer vaccine, then you shouldn't have your second dose, because that could potentially be dangerous. You would then need to have a discussion with the healthcare workers to decide what to do next, whether you need to maybe have a different vaccine or have it done in a more controlled environment, such as a hospital setting. There is a substance in the Pfizer vaccine called polyethylene glycol, which is the thing that triggers the allergic reaction that people are worried about. So if you have allergy to that particular substance, then potentially you could have a reaction to the vaccine. Now, polyethylene glycol, allergy to polyethylene glycol is very, very rare. I think the estimate is about 100,000 people. So it is very, very rare. If you imagine 100,000 people, it's like, it's like, so I'm a Manchester United fan. So if you imagine Old Trafford is like 76,000 capacity in Manchester. So if you went to a fully booked Man U match in Old Trafford, there would be one person in that huge crowd that potentially could be allergic to the polyethylene glycol. So it's a very rare condition. I don't think people should worry about it. People that have had things like Laxido, which is a common over-the-counter medication for constipation. If you have allergy to things like Laxido, you need to discuss with a healthcare worker, because Laxido and similar laxatives, and it's exactly that particular type of laxative, contains substances that are similar to polyethylene glycol. And you might need to have that discussion if you have had allergy to a particular laxative called Laxido, or other forms of laxatives called macrogols. So again, in summary, the allergy to polyethylene glycol is very rare indeed. If you have allergy to multiple medications, that can sometimes signal that you have allergy to an ingredient, which could be something in that class of chemicals. So if you have had allergy to multiple medications, a large number of medications, then you need to discuss with a healthcare worker. They will need to risk assess you to decide, what to do in terms of giving you the vaccine, whether you need to have a particular vaccine or have it in a particular environment. So I hope that helps.
Thank you very much. I think there was another question about allergy, but I think you've covered that bit. So there are now a number of questions, which I hope the panelists you can really take down. So we have, is it true the pharmaceutical companies escaped legal responsibility for civil claims? Then there's another question on, is it true the vaccine are still in the experimental stage? Then another question on, does the vaccine prevent attracting COVID-19 again? And then there is a question still on blood clots. If you suffer blood clots in your periods, is it advisable to take a vaccine? And then I think there's a question here, which I think Dr. Kuku, you've answered before. Do you need a yearly booster vaccine? And is it okay to continue to take vitamin D, zinc, and other supporting vitamins after getting the vaccine? So we have a number of questions and we have 8 more minutes. So maybe in just 1 minute each, you try to attend to the questions. Thank you.
So I'll answer the question that says, if you have the vaccine, can you still get COVID-19? So the vaccine actually doesn't prevent you from getting COVID-19. We need to establish that. What the vaccine does is it primes your body. It prepares your body to deal. So COVID-19 is the disease you get from exposure to the virus. When you get exposure to the virus, several things can happen. You can have a mild disease. And if you have a mild disease, some people have a mild disease, they don't even have any symptoms. Some people have, they have symptoms, but they can manage it at home. They don't even have to go to hospital. Some other people will have symptoms, they end up in A&E. They have an X-ray done, they're treated, they go home, they don't need admission. Another group of people will then get into hospital, the illness is severe enough for them to need admission. They're treated on the ward and they go home. Another group of people get into hospital, they're treated on the ward, the disease progresses, and then they end up in ITU and on ventilation. Another group of people end up in hospital, they may not even have ventilation, but then they die. Or some don't even end up in hospital and still die. So there are several levels and phases to the illness. When you get the vaccine, what it does is it prevents you from getting the complications. It doesn't necessarily prevent you from getting the disease. But if you get the disease, it's going to be mild. It's not going to be the one that would probably end up with complications, hospital admission, or even death. So we need to be aware that it is, because the vaccine, like with everything, is not 100%. So there is a small risk that you may get the infection, but the infection you get is not going to be severe enough to end you up in hospital or even lead to death. The other question is the person with heavy periods. If you have heavy periods, the vaccine shouldn't affect you. I guess you're probably thinking of the blood clots. So people that are at risk of increased clots on the pill should not have, and it is recommended that they should avoid the Oxford AstraZeneca vaccine. For now, you can have the Pfizer one because of the risk of blood clots, which is under investigation. But if you're having heavy periods, there's no reason why you shouldn't have any of the vaccines. There is no evidence that it affects you for now.
Thank you very much. So the question on, is it true the pharmaceutical companies escape legal responsibility for civil claims? And is it still being the vaccine? Well, there are now many vaccines. So which vaccine I mean, the person did not really mention which of the vaccine is still in the experimental stage.
Yeah, I think that there were reports that the government had signed an agreement with the pharmaceutical companies to limit liability from the vaccines. The details of this agreement, I'm not privy to. I'm not a lawyer, but I think that, you know, the way the courts work, if something were to go wrong, the courts will always find whoever is responsible. You can't write those things off completely with legal agreements. So I think people ask this question because they worry about things going wrong, but actually we've had so many people had the vaccines without any problems. So I don't think that's going to happen. So I hope that that's reassuring to people. We've had millions of people have the vaccine without any problems. Now the question about whether it's still in an experimental phase, I think that is unfortunately come out of the way, the language that scientists use and the regulators use. So there's something called post-marketing surveillance, which is also called phase 4 clinical trials. So when medications or vaccines are developed, they go through different stages of development called phases. They have 1, 2, 3, 4. In actual fact, it's only the 1, 2, and 3 that they do testing under very strict conditions before they then approve the medication or the vaccine. And all the vaccines that are available in the UK have been through 1, 2, 3, 4. So they have been found to be safe and effective. The phase 4, which is post-marketing surveillance, as the name suggests, is once a medication or vaccine has been approved and people are getting the vaccine or the medication, the regulatory agencies and the MHRA continues to monitor for side effects and any reactions to the vaccine. So it's something, it's sort of monitoring after a medication or a vaccine has been approved for use in the general population. And the reason they do that is because the clinical trials are only done on a small number of people. So there may be some rare side effects that may not be evident in small clinical trials when it's given to massive numbers in the population, we might notice some of the side effects. So it's not in trial, it's in phase 4. And phase 4 means that it's been approved, and therefore they're just looking for any side effects. Thank you.
Thank you very much, Dr. Ona. Dr. Kumaravel, do you want to, there's, I think, a number of questions about, can we not just eat healthy, do exercise, and just to, you know, be okay?
Yeah, sure. So the last year has been really a tricky time, a very challenging time for all of us. It's been an unprecedented illness, and we've all had challenges being separated from our family. We couldn't meet them. But while even when we are under lockdown, we can still continue to take care of your well-being. And it's really important that we exercise where possible, even if it's just indoors. And it's lovely, the weather is lovely. We can go out and do some gardening. We can climb upstairs and we can do some simple house chores and stay connected. So this is brilliant. So across the world, we can stay connected with our friends and family. So it's really important to stay connected, be active, keep learning something new, learn new dishes, and I'm experimenting with cooking, and try to volunteer. Volunteering is really important. It's helpful for your well-being. And so stay connected, be active, volunteer, and don't forget to take care of your physical and mental well-being, and continue taking your multivitamins as you've done so far. It will really help your immune system. Eat healthy and nutritious food. Thank you.
Yeah, thank you very much. So this is important. And there's a question about some people are just doing that and they're not getting COVID. Well, we also know that, yes, some people are doing that and not getting COVID, but some people are doing it and getting COVID. And some people are doing exercise and getting COVID. And that's why it's important to still ensure that we adhere to the different preventive measures and also access the vaccine as well. So I'm mindful of time. There's a question here about if a person got the AstraZeneca as, I think, first dose, can they change to another vaccine?
So the recommendation for now is that your second dose should be the same as your first dose. Recent guidance has come out for some exemptions, but I wouldn't go into the details of those exemptions. What you need to do is to discuss. So some of the exemptions would be, for example, if you had the first dose of Oxford AstraZeneca and you had side effects, then you wouldn't be having the second dose. You'll have a different vaccine. For some people, the latest guidance says for some people, they may have forgotten what their first dose was. So obviously there's a bit of guesswork in there as to what the second dose is. But the general guidance is that you have the same vaccine as your second dose. And it is important because the two vaccines in the UK are made differently. So one is the mRNA and a spike protein vaccine, which is the Pfizer one, while the other one is the adenovirus vector. And they're two different mechanisms. So it's quite important that you stick to the same vaccine as the first and second dose are the same vaccine. And if there's a need to do otherwise, your healthcare professional will discuss with you, and you can decide together.
Okay, thank you very much. And just also in relation to that, I think if you are below the age of 30, and also if you're prone to blood clots, you can have the option of choosing your vaccine. So there's just one more question left, which is about when is Johnson & Johnson coming to BLMK?
That's quite interesting, and I'm not surprised that has been asked because the FDA today has put a halt on the Johnson & Johnson vaccine. And before I came on here, I was actually in a room with the Americans discussing it because it's a hot topic, and it was on CNN. And that's just because they're experiencing a similar thing to what we experienced here with the Oxford AstraZeneca vaccine. But with them, they found 2 to 6 cases of blood clots episodes with the Johnson & Johnson. And that's actually more in the younger ones. So I think they said from age 18 to 49. I'm not sure the upper age limit, but that actually has cost them to pause it for now while they investigated. So for now, we're not aware of the Johnson & Johnson coming to the UK. I think 3 vaccines have been authorized in the UK, and they are the Pfizer, the Oxford AstraZeneca, and the Moderna. So Moderna is already been given out there in Wales, and hopefully that might come down to the UK for the 30 and under, just to address the concerns about blood clots risk with Oxford AstraZeneca vaccine.
Thank you very much. Somebody is clarifying our question, and after this one, we would close, because we want to honor our words that this is going to be for 1 hour. And thank you very much, everyone. Virtually everyone is still online. So this clarification is about blood clots again, which is the person wants to know the number of blood clots in BLMK. And maybe I can answer that question, because I think I looked that up. In the we only know about the number in the United Kingdom, which is about 70, if I'm right, Dr. Dyer. But we don't know how many in BLMK. But when you compare 70 to over 30 million people that have been vaccinated, I think that is a small number, but we don't know the number for BLMK. Dr. Dyer. Okay. You're on mute, Dr. Dyer.
Oh.
Yes.
When did I go next? I'm on mute.
Okay. Yeah, you're okay now.
Okay. Sorry,
yes.
I didn't get the question. I was answering things in the chat box.
Yeah, so the person was asking how many blood clots have been reported in BLMK. So I said the figures we have is for United Kingdom, not specific to BLMK.
Yeah, the figures I have is for the whole of the United Kingdom, and that's 79 out of about 30 million that has been vaccinated. I do not have any figures for BLMK, I'm sorry.
Yes, so we don't have that yet, but I don't know when it will be available. But again, it is a very small number of people, 70 cases reported in over 20 million AstraZeneca vaccine that have been administered in the United Kingdom. Another clarification is on vitamins after having the vaccine. Yes, please, it's okay to continue to take your vitamins, to continue to do your exercises, and also eat healthy. That's also all important. So after having your vaccine, is still, because you should do this even without having a vaccine anyway. So, but the important thing is to eat well and make sure that you're eating balanced diet. So that's very important. So I think we've answered all the questions here in the chat box, and thank you so much, everyone. And if you have any more questions, in the chat box, we've put some email addresses that you can send your questions to, or any of your inquiries. And if you have any problem at all, maybe you've had your first dose, you're having problem, getting your second dose done, or you just have any issues relating to vaccines, we have CCG representatives here who are leading on the vaccination. We also have public health for all the different county councils here as well. So you can send your requests to these email addresses in the chat box. And also if you need additional information at any point in time, because as we all know, you keep hearing rumors here and there, you can check the CCG website, you can check any of the county council's website. And also we have Dr. Dayo Kuku at Healing G Zone. You can also check out on Instagram. So
and also, sorry, Foye, on Instagram, if you go to at Healing G Zone and you click on the link in the bio, you will have access to a free PDF with frequently asked questions. And there is a booklet there that would actually answer all your questions. You can download it free of charge.
Thank you very much. So in 30 seconds before I call on Pastor Francis Vaughan to give the vote of thanks and we close, Dr. Bahati Kumaravel, Dr. Ona, do you have something to say in 30 seconds just for us to wrap up tonight?
I think I will just say from public health perspective, please, if you're invited to have the vaccine, if you're offered the vaccine, If you have any queries, speak to your GP, but please come forward and have the vaccinations, and vaccinations will save lives. They're safe and effective. Thank you.
Thank you very much.
Yeah, and I would like to thank everyone who has come to join us this evening, and I hope that it has been worth your time. And I think because of the way COVID affects us as a community, I think it's important that when we learn stuff and when our questions are answered, that we share what we have learned with our families and our community, so that together we can all come out of this pandemic. And just one more point about, we talk about risk and how rare these events are. Just very quickly, I'm just going to sort of try to illustrate that very quickly so that people don't leave worried about what is the risk here. So if I just very quickly share my screen. So this is from the BBC website. It shows estimates of the risk of having a serious side effect or death from COVID vaccine. And it's 11 in a million. Now, what is the risk of dying in a car accident in the UK? Is 38 in a million. So you're more likely to die in a car accident driving around to work and back than having serious harm from the vaccine. And even though we have this risk of dying from car accidents, nobody worries about it when they want to step into their car and drive out. So that just, I hope, puts the risk in perspective. Thank you very much for coming around. And I hope that it's been very useful to you tonight. Thank you.
Thank you very much. Thank you, everyone. And just final words from our hosts tonight, Pastor Francis Vaughan and Miracle Church. Thank you. Pastor Vaughan, please.
From the mere fact that you have asked Miracle Church to join in, then we must say tonight, may the eternal God bless all of you, because you know who I am, Christian minister serving the people, and your service to God, well appreciated. And thank you for clearing up some of the questions. I know that a number of other questions people are asking. We try our best as community to direct them to you, but from this time tonight, we must appreciate the fact that all the good works that you dear ones are doing. As I said, I travel the world, and my main objective of having the inoculation is because if I had to go earlier on to some countries and I had to be inoculated, so I thought, because I care for people, love people, and I realized that if this can, of course, help somebody, it's our duty to do our best, to guide them, to protect them. So whatever else can be done, and if us as a church can do anything more to help you, to promote this, that more people can really enjoy good health, fellowship, and of course, a life again where they can rejoice together. One German doctor told me some years ago that she carried out hundreds of operations during the war, but she normally said to her patients, if they could just whisper a little prayer before the operation, and they would say, doctor, we cannot pray, that's why we come to you. But she had her little closet in her hospital that she would never carry out. She said she never carried out one single operation without first asking the Lord to direct her thoughts and her hands. So doctors, may the eternal God bless you. I look forward to the day when you will come here. I have the rostrum polished for all of you. You will come and share with us. And if there's anything we can do to help somebody, we will do it with joy. I want to thank you all again for giving up your time to explain so much to us tonight. And I believe somebody will be helped through your good works. And God bless you and be with you until we meet again. Everyone, thank you. You can put your hands together anywhere you are tonight for these doctors. That's right. And honor them. God bless you all and be safe. And if I don't meet you here again on earth other than on the Zoom, I see you in glory. I'll come down and shake your hands. God bless you all. Hope to see you again. Keep safe, keep blessed. God bless you.
Thank you. Thank you so much, Pastor.
Thank you so much.
Thank you, everyone. And
Thank
thank you for joining us. Thank you so much. Have a lovely evening. Bye.
Thank you.
Bye.
Thank you.
You can stop recording, Homolara.
Yeah.